Hello, everybody. This is Melinda with Prince Agency Insurance. On behalf of our whole Prince Agency team, we are reaching out with some ARCID updates. So if you are receiving this email, it is because you are a Medicare client of ours, and this will be a quick Medicare update. Going into the next enrollment season, which officially we can start presenting plans on October 1st, but first applications, if people need to change plans, starts on October the 15th, continuing through December 7th. Updates for this coming year. There are many. The Inflation Reduction Act that was passed a while back and started affecting plans in 2025. Many of you maybe were beneficiaries of the fact that there is a $2,000 maximum out of pocket on prescription drug costs for everyone on Medicare in 2025. That maximum out of pocket on prescription costs will be going up to $2,100 next year. Some other things that are not completely established yet, but we have some decent estimates on would be Part B of Medicare premium is expected to be about $206.50 per month next year. If you are on original Medicare and you have to pay through your Part B of Medicare deductible before possibly your supplement plan kicks in and then picks up those leftover costs, that Part B deductible is expected to go up to about $288 for next year. Prescription costs, in addition to that $2,100 maximum out of pocket for next year, I'm going to flip to this next slide where the different stages of coverage that started only 3 stages now. There is no donut hole anymore. Prior to 2025, we had it's called a coverage gap or donut hole when people's costs went way up, possibly mid-year, depending on your prescription combinations. Now we are down to only 3 stages of coverage under prescriptions. The deductible stage, the initial coverage stage, and then catastrophic coverage stage. Deductible maximum for 2026 has gone up to $615. Not every plan has that $615 deductible. Some have no deductible at all. Some have a very low deductible. And some let you skip the deductible for, say, tiers 1 and 2, but then you would be subject to the deductible if you have those higher tiered drugs that would fall in tiers 3, 4, and 5. But in any case, the maximum that they're allowed to charge is $615 for next year. When you're in that initial coverage stage, you can see that it's 25% of the cost of the medication or less. That is often zero on tier 1 and tier 2 drugs, depending on the plan that you're on. And then again, that $2,100 maximum out of pocket, if you make it there, then your expenses are zero for your prescriptions for the rest of the calendar year. If you reached somewhere in that vicinity of that $2,000 this year, and you would expect that may happen to you again next year. If you did not take advantage of that payment plan, there is a payment plan in place that started in 2025, will continue into 2026. If you would like to pay that over, say, 12 installments throughout the year, instead of having to pay those high bills at the pharmacy point of service, you would want to reach out, I suggest in January, before you fill that first prescription, to the insurance company that your Part D prescription drug coverage is through. They will help facilitate setting up of that payment plan before you go purchase that first prescription at the pharmacy. Let's see, what else do we have here? National average cost of a standalone Part D drug plan has been about $32 a month. That's going up to about $34.50 a month. That really just affects the people who would have a late enrollment penalty, like they didn't add drug coverage when they were first eligible for Medicare and they may have to pay a penalty. It is a percentage of that national average. So as it goes up, unfortunately, that penalty goes up with it. Let's see. Cost of standalone Part D drug plans. We have $0 premium plans that are still available, but for 2025 and before, we often had 0 plans, and then we had sort of graduated level of plans as your prescriptions got more expensive and they went up. You had slightly higher premium if you chose a plan that covered more expensive medications, as an example, when we would do a review. Now what we're seeing in going into next year is that there's sort of a large gap between a few $0 premium plans, and then there's like one plan that is a fairly low, cost, if you will, and then they jump up to between $50 to $100 per month per prescription drug plan. So if you please look for your annual notice of change that you would receive in the mail, should have come within the last week. It will tell you what your premium is going to be on that plan for next year. Please look at it carefully. If you're on a standalone Part D and that premium is going up fairly high, please reach out. I'm going to go to our next screen with our contact information. Please reach out to your agent. If it's me, if I'm your agent, please use the service@princeagencyllc.com email address. And then the phone number, I'm sending you the phone number 616-290-0154. That you'll notice on the next line is Jeffrey's phone number. He manages my calendar and schedule and email and all of that. So he will help facilitate if we need to do a review. Katie's information, it's just Katie@princeagencyllc.com. Her direct number ends in 0153. And then Anna, the newest agent on our team, she is going to be assisting both Katie and myself. And she is Anna@princeagencyllc.com. Her phone number 616-290-0152. She may be helping us do some reviews and do application submissions if we do need to change plans. So moving on to Part C updates. Part C, Medicare Advantage. That's where we put the Part A, Hospital, B, Outpatient Services, and D, Pharmacy Drug Coverage all together on a complete package plan through a private insurance company. That $2,000 for this year and next year, $2,100 maximum out of pocket on prescriptions is having a ripple effect, if you will, on other benefits in the plans where they're utilizing some of those dollars toward the higher prescription drug costs that the carriers have to pay because the members that are enrolled in the plans are paying less for their prescriptions. So as we see that progress, we're seeing things like places where maybe there was no premium or a $0 premium on an Advantage plan before. Some of them are introducing new premiums. Usually they're not terribly high. If you didn't have a deductible before, we're starting to see small deductibles be introduced. Some were introduced in 2025, I think even more in 2026. And then those maximum out of pocket, as you pay those copays and co-insurances throughout the year on an Advantage plan, and they add toward that maximum out of pocket. When you reach that, then you have zero out of pocket after that. Those levels are going up a little bit as well. Reductions in things like dental and vision and hearing benefits, reductions in over-the-counter dollars that are available, and even Part B giveback. So some people have tried out some of those plans that basically you get charged less for your Part B of Medicare when you are enrolled in a plan that has a Part B giveback. Some of those are reducing the amount of benefit in that area as well. So those are some updates we're seeing. Moving on to Medicaid and Medicare together. So that's what we call dual eligible, people who are eligible for both at the same time. There's just hundreds of thousands of people that are being affected by the federal cuts to Medicaid benefits. And as they come up for redetermination, literally hundreds of thousands of people in the state of Michigan are losing eligibility for Medicaid. And so as maybe friends, family, neighbors, people you go to church with and things like that, you hear of people that maybe have lost their eligibility for Medicaid. I suggest have them reach out to get some help. We absolutely can help them. Make sure that they are enrolled in an appropriate Medicare plan to meet their needs and their budget. And it doesn't cost them anything, just like we help you at no cost. Overarchingly, that annual notice of change is the biggest thing I want people to look for. Please look for it. It should have arrived in the mail, like I said, in the last week. Don't throw it out. Don't bury it in your mail, stack of mail. Look at it. It is very timely. Make sure that the changes that you see knowing the ripple effect that I've explained that are happening to nearly every plan out there, as long as you're okay with those changes that you see in that annual notice of change, there is nothing that you actually need to do. And you can actually leave that plan alone and it will roll over automatically if you've been fairly happy with it and you're okay with the changes you see in your annual notice of change. There's nothing that you need to do. If, on the other hand, you see that your plan is exiting the market, and by that I mean there's a carrier in particular that is exiting the market in many counties in the state of Michigan. If you happen to get a notice like that, please, of course, reach out to us. If we don't already have your annual review scheduled, please reach out and get that scheduled, because you will lose your plan at the end of 2025. You will have a special election period and would have even up to 60 days to get enrolled in a new plan. And so that would be through, say, the end of February of 2026. And you could get new coverage started by even March 1st would be the latest. But of course, we'd rather you not have gaps in coverage. If there are a gap, you would go back to original Medicare Parts A and B only. You wouldn't have any drug coverage, which then could end up with lifetime penalties if you went too long. So please reach out if you get one of those notices. We will be sending out another email with some of those details regarding plans that are ending if you are specifically on one of those plans. All right. I think that is all I've got for now with market updates. So please contact us if you would like to do a review. And you might even reach out by email, because it is a busy time of the year. There are only so many hours during enrollment season, and we often need new updated information. So your doctors, your prescriptions, all of that. If you reach out via email, we can respond via email with a link to an intake form so that we get your most current information so that we can do an accurate review in a timely fashion. Okay. Take care, everyone. We're looking forward to seeing many of you soon in an in-person or virtual or phone appointment. Take care. Bye-bye.